starting these webinars, we are becoming more and more throughout the world. We know that the World Health Organization cannot do such a thing. That much we are doing. Every eminent doctors are coming day after day, making miraculous classes and wonderful lessons, giving us and making us a great force throughout the world. So we must share. I want to say that all of you must share your patients, your friends, and your all people throughout the world. You have to share all our videos day by day. Then only it will spread. Within no time, it will grow big. So today, our guest is Dr. RUDRAKHI Dey. She is an eminent personality. Many times she came to our platform for doing wonderful talks. Now, she is the assistant professor of organon of medicine, Sri Swaminarayanan Homeopathic Medical College, Kalol, Gandhinagar, Gujarat. Today, the topic is case presentation on vitiligo with homeopathic medicines. We know that one of the person, singer, dancer, Michael Jackson, once he was a black man. After that, he became a white man. So a color can be changed. We know that Deva and Asura in the Mahabharata and says that Deva and Asura, these two things are in our, each and every human being having these two qualities. One is the good quality and the other is the evil. We have to make it, bring forward or put out whatever inside us. So we all should always do whatever should come from our heart. That should be a gift for the whole humanity. So, Doctor, you are welcome. I believe that you are you may talk about the both things, the spiritual talk and at the same time you can do the outside of the man and inside of the man. These both are created by God, but we have to look the inside and outside. What Hahnemann said, the outer manifestations are the internal derangement. So you can start now. Okay.
Dr. Hubert, before she start, I can only thank Dr. RUDRAKHI today because she has agreed at the last moment because our today's speaker was not ready. So I asked her yesterday if she can do, and she agreed. So give a congratulations and best thank you, big thank you to Dr. RUDRAKHI. So you can proceed, Dr. RUDRAKHI.
Sir, next time I want my name should be correct.
It is not my mistake.
Sir, every time in every certificate, my name is different.
No, that I have mentioned. I have sent to the person who do that.
That's all I want in exchange.
That certificate will be exchanged. Definitely it will be changed. All the certificates will be changed. But I have forwarded your message to the right persons and I think it will be taken care.
Yes,
one person is also added to our community, moderator, Neha Kakar, Dr. Neha Kakar. It is very happy to see you again and again. If we have,
Dr. Hubert, and I also welcome Dr. RUDRAKHI Dey on my behalf and on behalf of IFPH for presenting the webinar today. It's a great pleasure to have you here, and thank you very much, Dr. Hubert Silva, for welcoming me. It's always an honor, sir. Yeah.
Thank you, Doctor.
This is a joint presentation, Dr. Kakar.
Sir, pardon, sir.
You and RUDRAKHI both will be presenting?
No, sir. No, sir. Sir, I am only the co-host here.
Okay. That I saw. Okay.
Yes,
whenever I fall, that time she may take care of me.
That's so kind of you, sir.
I was thinking like that.
Now, doctor, you can start now. Rudrakshi, doctor.
Yeah, Dr.
Rudrakshi.
Dhanesh has replied that name was corrected. Rudrakshi, your name is corrected now. Okay.
Okay, thank you.
I want my name to be corrected, that's all.
No, you see the message. You see the chat box. Dr. Dhanesh has already
Yeah, I
replied.
have seen.
So you start.
Thank you, sir. Shall I start?
Yeah, you can start now. Madam.
Yes, thank you. Thank you to all my seniors, all my seniors actually. I don't find anybody like you people. Every time I gain some knowledges, like my professors, my teachers, and my guide and mentors, sirs and madams, you were correcting me in every webinar. That's why only I used to come that to get the corrections and all. What's my wrong? What's my right to know about it? Today my case is actually this was already a ready case, so I thought to be present here because I didn't made a PPT today, but I have the documentation. I will be showing in MS Word that what vitiligo is. When I was practicing during COVID time in my hometown, so I had cured one patient, of child actually, and after that two patients came. They were under treatment, so they got a very good result, and they came from a very quack doctors or something like that, applying these that things, and after applying homeopathy, they got cured. So I will be describing what had happened, and last, but let us know what is vitiligo is first. My screen is visible, sir?
No. Share screen. You do share screen.
Is it visible?
Yeah. Now it is visible.
Yeah.
Yeah, we can see.
Vitiligo, often called leukoderma, it is oftenly known as leukoderma, is a disorder where the skin loses its color in patches of irregular shapes and size. This is a pigmentation disorder, which means melanocytes, that is melanin. The reduce of melanocytes, known as hypopigmentation, and the pigment producing cells is known as the melanocytes. And if it is reduced, it is still, the modern medicine says, then it is to be like vitiligo. In cases of pityriasis album, in cases of, we can see like white patches, but these are being differentiated with vitiligo. This results is development of white patches on the skin. Homeopathy medicine for vitiligo or arsenic sulflavum. Arsenic album. I have seen actually one cases in my UG. I have known arsenic sulflavum from that only. That one of my seniors, sir of organ of medicine HOD, he had cured one vitiligo patient by using arsenic sulflavum. Arsenic album, baryta mure, baryta carb, and can treat the problem effectively. Hairs, hairs which are growing in that area may lose their color and turns gray. These disorders also lead to psychological issues relating to appearance at times in certain individuals, many adolescents and young. This stress can take enormous proportion, particularly if vitiligo develops from visible areas of the body, such as face, arms, feet, and genitals. This develops very strong emotions of being embarrassed, depressed, and worried about how others will react. That's absolutely true. The like actually, vitiligo starts, it is said in that in book of medicine that vitiligo starts from the mucocutaneous junction, like sometimes it starts from the area of lip junction, or in the manifestation is very small, that is a little patch of white skin, it is started like a whitish discoloration, and it gets spread by times. So the first is, what causes vitiligo? We need to know that. The cause of vitiligo is not very clear about doctors. doctors, still the cause is actually unknown, an idiopathic cause. But some researchers are beginning to believe that vitiligo resembles an autoimmune disorders. In some book, it is written that vitiligo is an autoimmune disorder, which means that pigment that matters gives color to our skin producing cell of the skin are destroyed by the body's own antibodies, that is defense cell. The pigment that matters that gives color to our skin producing cells of the skin are destroyed by body's own antibody and defense cells. What causes vitiligo? In some cases, it has been observed that the onset of vitiligo is related to a psychological cause. Psychological causes. It has been observed in the onset of vitiligo related to and psychologically stressful events in the patient's life. People with a family history of vitiligo are more prone to develop these white patches. It is seen that people used to ask that does your family does having an vitiligo in your family history? So though it has been seen that in cases of vitiligo has more chance of vitiligo patients. 95% percent of all those who develop vitiligo start from developing symptoms before their 40th year of their life. Other factors that have been found in more common with those suffering from vitiligo are presence of an autoimmune disorder and history of sunburn, rashes, and other skin disorders, and hair turning gray before the age of 35. Symptoms of vitiligo. Vitiligo with people with vitiligo develops white patches on their skin, irregular shapes and sizes. Vitiligo is more common exposed areas, for example, hand, face, necks, arms. It also occurs on covered areas too, like genitals, breast, and legs. In some patients, hair may also turn gray sometimes early. In the inside of the mouth, white discoloration may also occur. The spread of vitiligo can be determined. It may stop completely after the first patch, but often these patches do spread. For some patients, further development may take years, and for other, large areas can be covered in months. In some patients, mental stress has been seen to increase the growth of these white patches. Actually, I have seen 2-3 cases in front of my one of my aunt who has suffered from suffering from vitiligo. It takes in some patient it progress fastly, but in some patient it progress slowly. Like like when she was in 16 years, she had a very little spot, and then at the age of 35 now she is getting an manifestations. So slowly the process of vitiligo went on. The next is homeopathy medicines for vitiligo. Homeopathy is an able to give wonderful miraculous cures in many cases of vitiligo. This is due to the fact that treatment enhances the natural production of pigments. According to philosophy, vitiligo not an disease itself, but an expression of but an expression of an inner disturbed state of the body. Thus, the cure should be occurred at the level where things have gone wrong. So here I will take to an organ part. An organ side one-sided disease, local disease, external manifestation of the disease. So and like Mark's venereal disease, like double complex disease. So these are a mixture of so many miasms, so many things. So this taken particular area where it gets manifested. So I will go like one vitiligo could be a one-sided disease or a local disease. Local disease is also same according to organ. The next is that prescription is based on the deepest level of understanding of the patient, disturbed inner forces, and although many homeopathic medicine like arsenic sulflavum, arsenic album, baritamune, baritacarb are known to give good results in vitiligo, I would again reiterate the fact that the real cure of vitiligo occurs when the prescription is made according to the true principle of homeopathic philosophy, that is treating the deep causative factor which cause this inner disturbance. Also remember, vitiligo is a chronic disorder and can consider time even the best homeopathy treatment for it and completely cure. Now start with calcarea carb. Calcarea carb is a top-grade constitutional medicines for vitiligo. It is prescribed the patients of vitiligo with milky white spots on skin. These white spots can appear anywhere in the body. In homeopathy, constitutional symptoms are given extreme importance in while selecting medicines in given cases. There is a unique constitution symptoms that guide in the selection of calcarea carb. The first among these tendency is free perspiration over the head, neck and chest. These are the main symptoms of calcarea carb, as we all know that. Next is intolerance of cold weather. Certain peculiar cravings may be present. Eggs, lime, pencils, persons needed calcarea carb may show tendency to catch cold easily. Weakness of bone may be also found. Easily fatigued by exertion. The tendency of chronic constipation and obesity also guide the selection of carb in vitiligo. On the mental sphere, person may show a number of fears, and the prominent fears among them are fear of misfortune and contagious disease, losing reasons, and of the insanity. Arsenic album for vitiligo in anxious personalities. Arsenic album is yet another useful remedy for vitiligo in person prone to dry, rough skin. The skin shows white spot and the skin is dry, dirty, and rough. The skin complains of alternating with the respiratory complaints like asthma and strong pointer for using arsenic album. The warm application over the skin and the warm drinks are highly desirable. Burning sensation in varying body parts may be also noticed. Extreme exhaustion may also be present, and there are peculiar constitutional symptoms that allow us to select arsenic album in vitiligo treatments. The most prominent out of these are fears, anxiety, and this remedy is often indicated in persons who have fear, including that of death, disease, germs, and catching the infections. Patients requiring arsenic albums are highly anxious and personalities. They may show anxious about the health, trifles, and anxiety about others. Marked restlessness is often seen on both mental and physical planes in person needing arsenic. Next distinctive feature for selecting arsenic album is vitiligo fastidiousness, and the person demanding extreme neatness and order in everything are yet another suitable subject requiring arsenic album. The next is sepia for vitiligo in people with indifferent attitudes. Sepia is another important remedy in the list, that is selected constitutionally in vitiligo. Treatment: if the constitutional picture of sepia matches with that of a person suffering with vitiligo, it possesses a great ability to completely eradicate the disease. Constitutional symptoms that indicates the use of sepia are having an indifferent approach towards life and family. They show aversion towards family members and friends who were once loved with great affection. They lack interest in doing any work. Tendency to avoid both physical or mental labor is present. They are constantly depressed with marked irritability and weeping tendency, desire to be alone, and an aversion to consolation or sympathy. The use of sepia must also be thought in women with menstrual irregularities or those around menopausal age with tendency to hot flushes. Next is Silesia. Silesia constitutional medicines for vitiligo. Silesia carries a good scope to treat vitiligo when selected as per constitutional makeup of the person. The set of symptoms that indicates the use of Silesia are pale, waxy skin, tendency to excessive perspiration on hands and feet, tendency to eruption with pus formation in various body parts, tendency to catch cold on frequent basis, lean, thin physical makeup. There are few characteristics, mind symptoms that need attention when selecting Silesia. The main mind symptoms are timidity and an underconfident nature. Silesia may be thought of people who seems underconfident, fear public speaking, timid and bashful. Obstinate behavior and stubbornness may also indicate the use of Silesia. The next is sulfur. Sulfur is one of the best medicines for vitiligo. Although sulfur is mentioned quite low down in the list of treating vitiligo, but its worth is equivalent to the above narrated medicines. Sulfur is a deep-acting medicine used frequently in treatment of varying skin disease, including vitiligo. It goes deep inside the basic root cause to annihilate the disease in its complete extent. The person requiring sulfur also usually shows an philosophical mindset. They are popularly referred as ragged philosopher. Their mind is constantly occupied with various theories and plans. As a result, they suffer from mental fatigue, absent-mindedness, and they take little or no care for their physical appearance, and even show aversion to bathing. Person who have suffered a lot from skin troubles, itchy skin with long-term use of ointment are also likely to be benefited from use of sulfur. Apart from all above said symptoms, burning sensation in various body parts may be present along with white spots on skin. An extraordinary craving for sweet may also be shown as constitutional symptoms. So here I am finished with that the selected remedy or the some best remedy as per my knowledge for treating vitiligo. So now I will present a case which I have made. Actually, this has been published in a paper journal. It is an abstract. A case report. A male patient 12 years with an hypopigmentation of skin white in color under the arms, around the chest for last 2 years, and it has gone bigger surface by times following other allopathic treatment but was not cured. There was no eruptions around. Systemic examination was normal. Local examination shows no itching, no irritation, and no lymphadenopathy.
Sorry to interrupt you, Dr. Rudrakshi.
Yes, ma'am.
Actually, we cannot see the case coming here.
The screen is not sharing, ma'am?
No, it's just showing your sulfur part, the part you were reading about sulfur.
Okay, ma'am. Is it showing now?
Just. Just a second. Yeah, now it's showing. Yeah, thank you, ma'am.
Yeah. So this is a case which has been published in a journal. So the introduction I have already given the phenomenon millicentimeter quadrism of the fetal. See, one I will like to mention something before that also. The etiology of vitiligo is unknown, but there are different theories to explain the pathogenesis. Vitiligo presents clinically in signs and symptoms with white spots. There are different clinical variants of vitiligo, which are trichome, marginal inflammatory, and quadricome vitiligo. The Koebner phenomenon developed of vitiligo is in special trauma prone sites like cut, burn, and abrasion, which is also known as keloid sometimes, and feet and faces favoring preauricular and preolar distribution. On the basis of the distribution, the pattern vitiligo classified into three types: generalized, segmental, and localized. The severity of the disease is scored by body surface area affected, and the course of the disease is often unpredictable and varies in response to the treatment. Depigmentation often cause of psychological distress and social stigmatization and low self-esteem. See, I have already said in aphorism 201, Hahnemann state the local affection, however, is never anything else than a part of a general disease, but a part of increased all in one direction by organic vital force, and transferred is less dangerous an external part of the body in order to alloy the internal ailments. The next is I am presenting the report. A male patient with 12 years with hypopigmentations of the skin, white in color, under the arms, around the chest for last 2 years. It has gone bigger by the time following other allopathy treatment, but was not cured. There was no eruption around and systemic examination was normal. Local examination shows no itching and no irritation and no lymphadenopathy. The history of present illness, and it was stated that about 2 years with a small spot on back. He used allopathic ointments and treated for 1 year without any significant relief. When it was not responded to medicine, he came here to visit the OPD in Homeopathy College. The family past history is the birth rashes of 1 month age and took conservative treatment, tonsillitis and fever, and 3 years ago took allopathic treatment. Next is family history. His father had multiple warts over face and back, and grandmother has neurofibroma, and his mother has PCOS earlier. This is the family history. His father has multiple warts over face and back, grandmother has neurofibroma, and the mother had PCOS earlier. Physical general. Is thermal is a hot patient, he cannot tolerate hot weather. Appetite for eating is often undigestible food. Thirst has normally had desire for cold food, ice creams cold, cold drinks, sweets. And tongue was slightly coated, dry, stool was regular and hard, regular and hard. Urine was normal. He has a tendency to sweat excessively and order offensive. Stool early, morning and after breakfast. Sleeps generally lying on abdomen. Next. Local examination, system examination was normal. Local examination shows normal. Hypopigmentation had seen on the areas and it had gone bigger surface by time. Analysis of the case. After analyzing the case with consideration of the physical general and particular symptoms, we consider the totality, the nature of pigmentation of the skin and the desire for cold food and drinks, family history, along with the profuse perspiration was included in the totality. Symptoms. And now I have also diagnosed the miasmatic diagnosis. I have evaluated in miasmatic evaluation. Desire for cold food, syphilitic, desire for profuse perspiration, perspiration, fishy order psychosis, stool after breakfast psychosis, sleeping lying on abdomen psychosis, thermal reaction hot psychosis. The next is repertorization. As I was in OPD that time, we were not that we have to using our manual things. So this is an repertorial sheet. The stomach desire cold drinks, 484 page according to Kent. Perspiration order offensive 1 to 9, 8 page. Perspiration profuse 1 to 9. Skin discolorization, white spots. Sleep position on abdomen. Generalities warm aggravation. By this is the case. On first visit 11-3-202, hypopigmentation of skin, whitish color on the left side of the chest. I have given medurinum 200, 1 dose OD per day. Placebo then. Second visit was on after 2 months, 15-5. Like it is March, April, May 15. Slight changes on the outer surface of the hypopigmented area. Again, medurinum 200 has been given after 2 months. Next, third dose, third visit on the 8th, that is August. Hypopigmentation areas less now. See, this is the case. First visit, this is second visit, and this is a third visit. Third visit was nihilinum, placebo. And dose 1, placebo 1 drachm, and of the normal skin time. And here is the fourth visit with a normal skin color. No hyperpigmentation, recovery of the skin tone. Fourth visit, date is on October. So the patient came to me on first visit was 3 March, and the final visit was October. So as I said before, it only sulfur is a good medicine. Your sulfur to be given in cases of all the skin disease. It actually doesn't. Sulfur is an obviously sulfur. Hahnemann also always said that sulfur should be given in every beginning of a skin disease treatment. But in some cases where the miasmatic predominancy is more, or the miasmatic prescription is more after repertoire analysis, if we see that medurinum, in here the case is medurinum has came. So I have given medurinum, started the treatment with medurinum and sticked with medurinum also. And the patient has been cured by medurinum 200. The discussion and the conclusion I have given. This is actually some references I have written as it has been published to a journal. So here is my case I have presented on vitiligo. So that's all today. I want some views from my seniors that anything you want. Actually, I would like to say that vitiligo not only an physical disease, it is actually some scientific, some mental disease also. If we go to the mental disease in aphorism 2010, Organon said that fourth mental disease is like traumatizing for some time, and it after that comes to physical times. So it can be and every time modern science is saying that there is some psychosomatic cause, there is some psychosomatic cause, and who will find the psychosomatic cause? Obviously, homeopathy can work in there. This is a limitation of modern science. Actually, they doesn't go to the that psychotic approaches. Like many diseases are there in many autoimmune diseases. For example, autism. Autism is spreading like now. When I was in my school days, there is a movie came like Tarism in Per and all. Okay, so autism is also an autoimmune disease, but there is no cause. Some like in some there should be an intrauterine life cause, as I have said on my previous lectures, previous sessions also, that we need to go to the retrospective of that studies. Retrospective study means to go to the cause. If we can't find the cause, first visit, second visit, third visit, like Robert said, that wrap of fabric. There is a term in Robert's philosophy, wrap of fabric. Wrap of fabric is like disease and disease, like, and fabric in woolen, like in wools or something like that, we see that it has been wrapping up by some fabrics, some silk, some threads, and then slightly schemes out. For example, a wrap of in a disease is also being wrapped by some external phenomena, like some mental diseases or some other things. So in this way, if we discloses the threads and we find out the cause, in many whole ultimate in whole organon of medicine book, and even ultimately if you go to obvious cause, accessory circumstances, lesser accessory symptoms, everything, you will see that every time Honeyman is telling go to the cause, go to the cause, go to the cause. If in every approaches it is always said that go to the cause. So if we remove the cause, the disease is removed to the tolle causam and all. This is a effectus is at causa. So the thing is, in vitiligo patient or some these like local diseases or some these autoimmune diseases, there is some mental causes. For example, if like these aren't sometimes within small things, this become a social stigma. Like if in women, especially, I will say, male will not be like having that. Male doesn't in a society, male dominating like in Indian, male doesn't have to face social stigmas like, but still I will tell this is to the females, because if a female start beginning of an whitish discolorization and people will ask her, hey, what had happened, what, why, or then like you will be having this continuity in your whole life, whether your mother was also suffering from this or you are also suffering. So these causes, and every day asking somebody like this causes an social stigma, and this has also causes this will only increase the grief of that person. Neither it will increase that grief, not only the neither decrease that person uh, agony or the grief. So, vitiligo is absolutely an autoimmune disease, and passively and actively with the studying of the case taking physically, we need to know the mental case taking also and the mental generals. We need to know that mental general of the patient, to know the grief, to know the past history, like past traumatized history, who like past intrauterine life history. So in this way, we can get the totality and draw the portrait of the disease, and ultimately we can cure holistically. So that's all I want to say for today. I welcome all my seniors to tell my views and to tell views on my session today. And if I am any wrong was anything, I am just beginning of my career, then please correct me and make me realize.
Okay, Dr. Rudrakshi, it was a wonderful session from your side. You briefed us about the knowledge of about the vitiligo, its causes, its probable causes, and their different types, and also how homeopathy, by use of constitutional treatment, can help us to eradicate this disease from the base or from the root, because only homeopathy, through the use of psychosomatic background, we can annihilate the disease. So, and you also presented two wonderful cases where you can see how homeopathy has brought about the cure slowly and surely. So
Yeah.
it was a very wonderful session, ma'am. And now I would like to invite other participants to ask any questions or any inputs or feedback to Rudrakshi, Dr. Rudrakshi.
Doctor, I want to know, there is written syphilinum or nihilinum, which the...
Sir, syphilinum is said to be nihilinum.
Okay, it is a new knowledge for me. Okay, now Dr. Rampresh Shah. Unmute, sir, and you can ask.
Thank you, everyone, and congratulations, Dr. Rudrakhi Dey. Very thanks. Excellent session. And vitiligo case presentation, very nice. Deals very medicine cause of mathematic and mental, grief, anger, anything. Actually, really, cause of vitiligo, mental symptom, mental cause. Yeah, suppression, mental suppression, anger, grief, anxiety. Very nice presentation. Thank you, Rudrakshi. Thank you. Very nice. Thank you.
Now, Dr. Harihan, sir.
Okay. Good evening, Dr. Rudrani Dev. See, here in our area.
Sir used to call me Rudrani every day.
Rudrani. Okay, very good.
I got
Dr.
a new name.
Rudrakshi, I guess you should change your name now.
No, in every session, sir used to call me. I got a new name from IFPH.
That's good. You have so many names. And,
Yes.
yeah, and Rudrakshi is a very good name. You know, Rudrakshi means from the
Fairy eyes.
Rudraksh. Yes, from the Rudraksh or from Lord Shiva's
Eyes.
yeah, so that's a very beautiful name.
Yes.
Okay. So when the language changes, the pronunciation also changes.
No, sir. I really enjoy and really I'm grateful to get such names. It's like in blessings, and you people are so senior to me.
Okay. Then, doctor, your class is very informative. Thank you. Thank you. See, what you said is very correct. See, suppressions. In my these 45 years of experience, what I felt is that most of all diseases, chronic diseases, are due to suppressions. That I sometimes it may be from house, from the social area, from such from there they are getting suppression and it is manifesting as this say autoimmune diseases. And another thing I like to add, see, one day in our 18th century, that see you know the leprosy was prevalent at that time.
Yes.
After that, that is suppressed by means of ointments or allopathic drugs and all. Then what developed after that is tuberculosis.
Yes. It is mentioned.
That also suppressed by vaccination or something else, or by the both diseases is by AFB and acid first bacil.
Yes.
When that these diseases are suppressed, again
In
what?
Stuart laws it is mentioned, sir.
Okay, what?
In Stuart laws it is given.
Okay. Then what happened is now a lot of see autism children are born now. See, retrospective effect. If we inquire this, we can find out the cause.
Yes.
So nowadays, vitiligo is also, I am seeing a lot of patients are coming to us and we are all doing the constitutional method and taking the history. And what now your case taking is very nice. I am appreciating that. See, why not you found that it is a psychotic miasm and you prescribe the medorinum. That is also very correct remedy. And so it got the result.
Yes.
Anyway, doctor, your class is very nice. Your case taking is nice. You come again. Okay. Thank you very much.
I love to.
Okay.
Thank you.
Yesterday or day before yesterday, one doctor, a famous doctor from allopathy, came to our platform. You might have heard about it. That time I asked a question to him that whether in aggression or this type of angry and some psychological problems, I asked him, what is happening in such conditions, there in psychological disturbances, what are the hormonal changes happening in human being, general human being. But he told us that he took an example of menopausal, menses, before menses. There is some, we know that premenstrual disorder. We know that there are psychological problems, angry and everything. That time hormonal changes will be there. So he told that he was a big doctor in America. He's a medical doctor in India. He was a professor. I think that he was a professor. And he told that for that premenstrual problems, there is no medicine in the world. You might have heard it. There is no medicine.
Yes, sir. I am writing a paper on this now.
That time he told that there is no medicine and no treatment. Only we can do some psychological. That is the limitation of more allopathic medicine. We have plenty of medicines. We are always doing starting from pulsatilla to acconite to syngament. We can go for these type of cases. So we have plenty of medicines for treating, but we are not doing wonderful things. That
Yes,
is what.
sir. What I think, now presently, I am associated with some SSIP project, like Student Startup Innovative Project. So there we started, this is my theory actually, photodermal theory according to homeopathy, like approach to cancer by law of similia. This is the topic. So we got such fundings from such companies. Like if homeopathy goes on, like IIT now, recent on 6th of February, I have visited IIT and got collab with an engineer, biological associated professor, sir. He has an like the gas bubbles formation. And I thought that we will be doing homeopathy nanopartically, and we will be giving to the cancerous cell. And chemotherapy, the photodermal therapy plus PTT. This is new, it is going. And I told them that we can give our nanoparticle medicines. Like we have selected some photosensitizer medicine. So nobody knows that homeopathy has photosensitizing medicines. Like homeopathic medicine can bear the sun heat. And after passing through the body cells also, the heat is still maintained and the photosensitizing agent will be continuing. And the apoptosis of the cell can be always be like it is apoptosis bhi rok jayega usme se. And we have explained it in scientific in Vignan Sammelan, Bharatiya Vignan Sammelan last in January. I have presented there, and there we gotten so much good response also. So now I would say some turmerics are there, some turmerical medicines are there. So which have some Ayurveda use that medicines for the benign hypertrophy of prostate or something like that, which are having anti-inflammatory antigens. So if we use homeopathic in a scientifically proof, homeopathy is no doubt an scientific treatment. But if we start proving things we just what the modern medicine says, like they criticize us कि यार पानी में मिला के तो बबस देते हो. This is what they say. But the thing is, the inherent power of the medicine is inside. Now they came like nanotechnology. Now they say no, homeopathy has nanoparticles, so the medicine can be done. Those who are scientific, those who are scientists, they always agree with homeopathy. I just want to share an experience.
Thank you, Doctor. I saw on news in Kerala they have started 40 new dispensaries in our state. That is a government geo. That is in Kerala. We had suffered a lot during the time of COVID. That time we could not do anything, but in everywhere they can do in India, everywhere they can use homeopathic medicines. But here it is prohibited. Nobody should give homeopathic medicine till we have to suffer for 1.5 years. They did not allow us to treat COVID with homeopathic medicine. Now all are changing because after this 1.5 years, But we all doctors are done many treatment we have done. After they are giving homeopathic medicines as a preventive medicine for the students, and they started, schools are opened. And
Yes, in
till
Gujarat
now,
also,
it
they
is
had
going on.
given arsenic
No death,
albums like in an house.
no death, no death cases after
Yes,
giving
yes,
homeopathic medicines. We have
yes,
treated, we all doctors having
yes.
vast experience in using
Now,
homeopathic
sir,
medicine.
modern medicine is craving for cancer. They are like flies. They are like flying about around the cancer, and they just want to find that which is that less effective, like less side effect treatment that will cure the cancer and all. Now every research is going on cancer, cancer, cancer. Last time in Vignan Sammelan, every researcher explaining cancer, everybody. Some Ayurveda sir, madam, they were also explaining cancer, cancer. People are like finding like cancer. Now cancer is a very hot term topic. So recently I was also being a part of Center of Bioscience and Nano Research in Coimbatore. In faculty development program, I was there. So some people were asking that how homeopathy is in curing cancers and all, how nanoparticle will work and all. This I said that this has been already proved by IIT. What is new in that? So people doesn't know about it.
5.5 years back, I was, I am a patient of cancer. That time they told me that to take out, cut out, cut and throw it away my half of my jawbone.
Oh my God.
Still I am living with full
Wonderful
jaw.
mind.
I am using 6 doctors in our Kerala, the eminent doctors, the number one doctors of modern allopathic medicines, they told me that you have to do surgery within no time, otherwise you will die. I thought, if I remove my 25% of my face, what will be my face? I cannot do anything. I will lie like a I have to live like a dead person. So
Yes.
I left. Then I started taking homeopathic medicine. I am living now. I'm doing so many things. I became a grandfather of 2 children. These are my daily. I am updating. I am doing
Living
the
your life 200%.
editing of our videos and uploading it daily, 4 or 5
Nice, nice.
videos daily in 3 languages. These are all things. That is the greatness of homeopathy and God.
Yes, yes.
Yeah, it is a God-given medicine. So we are very much proud of it because we can treat from the head to foot of a person, internal and external. No medicine can do such things.
Actually, sir,
Hahnemann says,
it is not the limitation is we. We
yeah,
are limiting it.
we all are
We are
limited.
limiting. We fight among ourselves and we don't go among others.
Each and every day we will understand that after entering in the IFPH platform, then we know that our limitations are growing. Day by day, our limitations are growing by hearing many doctors' talks and everything. So I think that Muhammad Saitan, sir, you can unmute, sir. You can ask. He's from Jordan.
Yes, am I audible, please? Am I audible, please?
Yeah, you are audible, sir.
Thank you. Ma'am, we have the principles of oxidative stress, oxidative medicine, and we have the principle of biophysics, which is the electron pair resonance repair, where we can classify homeopathy. Does it mimic any of those, whether they are the oxidation, oxidative stress, or the biophysics principles? Does it match, or it is something else? Thank you.
Dr. Manoj. What is your question, sir? What is your question?
The question is, we have two principles. We have the oxidative medicine. It is on the cellular level. It is the electron pair resonance repair. Does homeopathy matches any of those?
In the repair
Did you
program.
understand me?
Yes, homeopathy matches those. Obviously.
Matches
The biophysics said the
both?
particles, the electrons and protons after that Avogadro number, that homeopathy medicine is after the Avogadro numbers. That is only nanoparticle said. And the inherent power of the drug is already inherited. It doesn't destroy it. After that, beyond Avogadro number, that is homeopathy number.
And we have the energy.
Yes. And the energy remain instant. It doesn't go.
Okay,
The medicinal property of that particle will remain inherited.
Very clear, sir? That is one, I heard from one scientist said that each and every time the potentization, doing the potentization, that time the nanoparticles, number of nanoparticles,
it increases.
Increases.
The power of the nanoparticle increased. Yes, sir.
No. The power, not the number of particles of the nanoparticles are increasing.
Sir, it has many research paper has been published under IIT and some I do have such paper. I one day I will show that I have collected some papers where that pharmaceutically it is proved that trituration is a totally scientific process. And it is totally developed, totally based on physics.
Yes. Now, Dr. Neha.
No, again he raised.
You go do.
Dr. Rudrakshi, I wanted to ask, your cases show a very good improvement in the cases, but in my personal practice, I have seen certain vitiligo cases which get aggravated sometimes after taking homeopathic medicines. Like I had a patient who had a small patch on his neck, but and I guess I gave him arsenic sulflavum, and that too in 3x potency. And after 1 week of medicine, that patch grew like this. So it's very discomforting for the patient. And sometimes it's also very, disheartening for us also. So can you brief us about some medicines which we can use to counter fight those effects, and we can decrease the aggravation? Because sometimes that
after the aggravation, does it got cured?
No, it didn't get cured. And I stopped the medicine, and even after 1 month, that patch remained the same.
So it is sometimes the potency, maybe the selection of the remedy is correct, but the potency is like arsenic sulflavum 200 or in high dose, it could have worked.
Okay. No, so can we give something, any?
Ma'am, Mullen well is an external application.
Okay.
And one name of that well, I just forgot that name.
We can use some medicines like Nux vomica or sulfur or something like that, so that bad effect of that medicine that caused the aggravation can be brought down. Can we use some medicines like that?
Dr. Neha, it's time to wind up. After 9 o'clock, we have the start the Malayalam.
Yeah, sure, sir. I just was asking one question. Yes. Okay, sir. Yeah, sure, sir. So that's okay. Actually, we will take that next time.
Yes, Bhupchi well. I was just about to say that.
Yeah, okay, fine. Yeah, thank you so much. And I would like to say a very nice vote of thanks to you
for
presenting so nice cases on the topic of vitiligo. And you are doing a very good work in research of homeopathy by collaborating with different IIT and nanotechnology people. That will give a very much needed boost to homeopathy. And we need more such people who can do this, you can say brave work, so that you can take homeopathy forward in a scientific way.
Yes.
So very nice session with Dr. Rudrakshi Dey, and we hope to have more informative sessions from you. Thank you.
Thank you.
Yeah.
എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1264 ദിവസത്തെ മലയാളം സെഷനിലേക്ക് സ്വാഗതം. ആദ്യം ഒരു നിമിഷത്തെ മൗന പ്രാർത്ഥന.